Hello and welcome to the Real Life Cafe. My name is Juliet. Thank you so much for joining us. Thank you for your continued support. Today we are going to discuss about mental health. We are going to discuss about the causes and also learn some of the signs that will help you know whether you're mentally okay or not. I'm joined by Wilkisa Juma, a counseling psychologist who will help us narrow down on this topic. Hi Wilkisa.
Hi, how are you?
I'm good, wewe?
I'm very fine.
Good to see you today.
The pleasure is mine. Yeah.
Well, how have you been since we met last time?
I've been good, I thank God for that. Yeah, so
Okay.
good. Yeah.
Oh, that's nice. Our topic today is about mental health awareness. Nowadays unakaa unasikia mtu amejua, mwingine, you know, things are happening. So it's good to keep on checking on people. Hata mkikutana na mtu, muulize vile amekuwa since you met last time. For the person meeting you for the first time, introduce yourself and tell us what you do.
Hello, my name is Wilkisa Juma. I'm a counseling psychologist. That's all. So I deal with mental health issues. I'm so passionate about mental health. I do personal therapy to people who are having issues, and yeah, basically it's about mental health. Yeah.
Okay. Mental health. Mental health ni nini?
Okay, mental health is that ability for you to be able to function normally, for you to feel like you're sober enough, when you feel like you are okay, you are not stressed, you are not behaving in ways that are not normal. Other people will not look at you and think, okay, there's something off about this person. Yeah, so it's the wellness of the brain, wellness of your thoughts, wellness of your actions, and wellness of your behavior. That is mental health. And then mental unwellness means that you are the opposite of that. Your thoughts are not okay, they are distorted. Your feelings, your emotions are not okay. And then your actions or your behaviors are not okay. Yeah, it means that mentally you're not doing well. Yeah.
And before we continue, nowadays there's so many cases. People are killing themselves. You just wake up, somebody just, you know, they either took poison, they hang themselves. People are fighting in relationships. Some are even killing their own children, harming people closer to you. And you know, you just ask yourself, what is happening?
I would say a lot is happening. Hata uchumi tu.
Yeah.
Hatuna pesa kwa mifuko.
Yeah.
You don't have money. The stresses that come with lack of money, the stresses that come with day-to-day conflicts. There's a lot that is happening, and then the worst part is that people are not aware about their mental wellness. So you are not aware of when things go bad, when you are supposed to go and see a specialist. So you find that when symptoms, wakati unaanza kuwa na symptoms za kuonyesha kwamba you're not doing well mentally, kuna kitu kibaya wapi? In your brain. Because you don't have that education, so you don't even realize that things are going bad. You start having that feeling of being worthless. So you ask yourself, what is life? I think I'm having so many problems. I'm having issues. You know, you cannot cope with the day-to-day stresses, and the only solution when it gets to that point is you think of self-harm. How do I just get over it? So you find people who are not able to cope with day-to-day stresses, and people who are not able to relate well with others, they can't fit, you see. Ask yourself, kwa nini mtu mmoja awe na watu wawili wakuwe na shida same, but mtu mmoja anaweza deal na hiyo problem na mwingine hawezi? It means there is there's a problem with the person who cannot deal with the issue. So that is where the problem, being unable to understand when you've reached a point of, a point whereby you are supposed to seek help, maybe psychotherapy or see a psychiatrist, see a doctor, but you didn't go because you didn't know that you are having issues. Wewe ulifikiria uko sawa tu. And you start locking yourself in your house. Unajifungia, hutaki kwenda job. Hautaki kushiriki na watu wengine, zile vitu ulikuwa unapenda kufanya, you don't want to do them anymore. You isolate yourself completely. You withdraw from everything and everyone. That is when unafaa ujue now things are not okay. Mambo yameharibika. Mbona najifungia? Mbona sitaki kuoga? Mbona sitaki kuongea? Why are my moods? You cannot explain. Hata mtu kama hajakukosea unasikia kiasira kingine tu. Irritability. You get so irritable for no good reasons. Your moods keep changing. Sometimes they are very low. Sometimes you are hyper, just laughing. You want to talk to people. Yeah, you cannot explain all those things. So it's good to know, to tell people, so that they can understand themselves. They can know when things are not going on right in their brain.
Okay.
Yes.
And people killing each other, ni madawa ama, you know, I'm just trying to imagine, niamke, tuko na wewe hapa, nichukue kisu, nikudunge. I don't know.
I wish you can have like this topic and talk about it, like for people to understand what happens. But there are many reasons why people do whatever they do. Some are just psychopaths. Ni watu tu akili zao ziko na shida. It's a wide topic. To understand human beings. There are those people who have mental illnesses. You say they are psychopathological. There are people, like I've said, who cannot stand the stresses of life. So just things go bad. We have serial killers, people who went through torture or abuse when they were young, or they have PTSD, post-trauma stress disorders. So there are many reasons why people do whatever they do. But it's all about mental health. There is something which is not right with that person. Do you know that we even have people who crave for blood?
What do you mean?
Yes, you can have two people who they have a mental issue where they want, like seeing blood, like wanapenda kuchinja, or they like kuona damu tu. So what happens with these people is if they are brought up in a good environment, a positive environment where they are encouraged, and maybe they are sharp, their IQ is good, they are clever, they end up being surgeons. Or not all surgeons have mental problems, but we have issues whereby a person chooses now a career depending on the way they feel about themselves, the personality disorders in them. But imagine this person if it does not get good education. Asiposoma vizuri atakuwa nini? A murderer, mwizi anadunga watu visu kwa streets, you know.
Now that makes them happy. They feel
it
content.
gives them fulfillment.
Oh, wow.
It's a mental problem. We have many issues out there. Yeah, so you cannot really tell why that person did whatever they did, because if it's a serial killer, they will kill. You can actually know their target. Like if they are targeting girls, they will kill girls. Maybe because this person was mistreated. Maybe aliteswa na a stepmother or a person when they were young. Alikuwa, there's something that happened to this person. So akikuwa mkubwa amepata nguvu, anaanza kutarget. Most of them watakuwa kuna kitu ilifanyika as they were growing up. Yes.
Okay. So help us understand, you know, what causes the mental health step by step. Ndio hata mtu anaweza tunaitaje, evaluate yourself. Ni nini ina cause mental health ndio tufike pale tuseme now things are not okay.
Causes si moja, ziko different. from having a chemical imbalance kwa brain, like neurotransmitters, we call them neurotransmitters. If you have an imbalance in the brain, you're likely to have a mental health challenge. The most common or the basic one is genetic. Most people who have mental health issues, hata depression unapata, it runs in their blood. So it just needs a katrigger, small katrigger kidogo. Then unapata, you have a mental health issue. So I would put genetics as one of them. Imagine mpaka alcoholism, ulevi is genetic.
Oh, really?
Yeah, that is why you find that this family ni walevi. So you have that gene in you that attracts that. Okay. So you are advised not to start it. Juu pombe si itakuita kuambia now because kuna gene, come here and drink me. Yeah, so most of this genetic, kuna those imbalances in the brain, and then kuna other factors, especially if you have that genetic predisposition. What happens is if you start taking drugs, of course we have drug-induced psychosis. You can trigger mental issues by taking drugs. So we call it psychosis. Any mental illnesses, we say you are psychotic. So you can trigger that. Unaweza ukachokoza, maybe it's in your blood, iko kwa ukoo wenu kwamba mental problems ziko kwa akili, kwa ukoo. So you start taking drugs. Unaanza kutumia marijuana, bangi, ama kulewa. If you do that, you are likely, ni rahisi sana wewe kutrigger hiyo mental problem ambayo ilikuwa kwa familia, ina run kwa damu yenu, sasa umepata hiyo mental problem. So tumesema genetic, lakini genetic inaweza nyamaza tu mpaka uchokoze.
Okay.
And then you can have it like neurotransmitters, the chemical imbalance in your brain. Akili yako, brain yako iko na problem fulani. And then mtoto akiwa kwa tumbo pia anaweza kuwa affected. Unaweza affect mtoto wako akiwa kwa tumbo. Kwa madawa ile utatumia, kwa toxins zile, environment ile unakaa. If your environment is not safe for the baby in the womb, the metals and all that, akili ya mtoto inaweza kuwa affected. Kuna ile discomfort ya mama, abuse. Wewe mwenyewe you are abused but your child suffers. Anapata,
when you are expectant.
Yes, you're not supposed to be stressed, overstressed when you are pregnant. Your partner is not supposed to like insult you, abuse you physically and all that. Mtu anakupiga uko mjamzito, anakutukana. Hiyo inaweza leta madhara kwa mtoto mentally. Mtoto anazaliwa, by the way kuna mtu atazaliwa hata akiona huyo mtu unaona tu anaanza kulia.
Unashangaa ulimkosea nini?
Unashindwa huyo mtu akikaribia mtoto analia.
Kumbe ulikosea mama.
Ulikosea mama. And you know the baby in the womb, they can sense, they can hear, they know your voice before they are born. They can feel the surrounding. They can feel when you are happy and when you are unhappy. Even as a mother, you will see the movements. Kipigiwa kelele sana atarukaruka. So the importance of mental health awareness ni kuambia watu so that wanaelewa. Kama ni mtu ambaye bibi yake ni mjamzito, ana take care of the wife. Si ati abuse, insult, because you are insulting even the baby. The baby is having those feelings. Yeah, so another cause now that we've mentioned motherhood, there's that kind of psychosis you get when you give birth. You can be depressed, postpartum depression. Kuna watu when they give birth, maybe it's genetic, or because of the stresses they go through, prolonged labor, issues during childbirth and pregnancy, they can make you have that kind of psychosis, whereby you've even seen women killing their own children.
Yes.
Yeah, you can't understand that.
Ama anamtupa.
Ama anamtupa. So we have that kind of psychosis also, but it happens to women who've given birth only. So it's good to check on this mama. The first months, angalia mama, ukiona anakuambia ataua huyu mtoto, anaweza huyu mtoto. Akisema huyu nitamdunga kisu, she can do that, alafu watu wanaanza kuuliza kwa nini huyu mama ameua mtoto wake. Amechukua watoto amerusha kwa mto, and such like things. Tuko na sababu za exposure. Ile environment ambayo unakaa. You avoid toxic environment. Kuna environment unaweza kaa mpaka unasikia kichwa kifanyi kazi. Yeah. Working environment where you are insulted, you are living with a person mwenye saa zote we ni mjinga, we ni nini, unaona? Unaishi na mtu anaku abuse. And imagine if you have that genetic predisposition, it's so easy for you to
be in that line.
Yeah, in that to have mental health issues. You get stress, accumulated stress to the point whereby you're not able to operate normally. Yeah, so there are those people who are exposed because of their work, like soldiers, when they go for combat out there. So they get exposed to such environments. Children who are born in homes that are not so safe. Children who are abused. Unapata mtoto maybe anakaa na familia ambao sio biological parents, wanatesa huyu mtoto, so anakuwa na later on as vile anagrow anapata PTSD. So inaweza kuwa ni effect iko kwa brain, inaweza kuwa ni ina run kwa damu, it's genetic. Inaweza kuwa ni abuse or exposure, environmental factors. You are exposed to trauma, to suffering, to problems, to toxic relationships, toxic parenting, and all that. They can easily trigger mental health issues.
Okay.
Yes.
Wow. Interesting. And now that you've mentioned the causes, how about the signs, so that people can understand? Ukianza kusikia hivi, jua it's not
Kuna
okay.
shida.
Unaona? Ndio watu waweze kuelewa. Kwa sababu most of the times I think it's because people don't know. Exactly. Unajipata na tu signs tu kidogo kidogo, you think it's normal, you think it's kawaida, but kumbe kuna shida. So tell us, what are those signs?
Before I tell you the signs, most people don't know that mental issues are many. Yani magonjwa ya akili ni nyingi kabisa. Just like the other diseases. Uko na severe malaria, uko na nini.
Hey.
So when you see a person walking and showing signs of psychosis, you might not know exactly what they're suffering from. And then mental issues, I want you to think of your brain like a computer.
Okay, my brain as a computer.
As a computer, which operates the whole system.
Yes.
Yeah?
Yeah.
So brain yako ni computer, na ndio ina operate mwili wako wote.
Okay.
So part kidogo ikiwa affected, a small part of the system is affected, you find that you will not function normally. So that is why you see people with psychosis doing things that are not kawaida, you know.
Oh.
Yes, because that part of the computer has a
problem.
Yeah, a default. So the moment you understand that way, hautasema mtu akiokota takataka huku akitembea hajanyua nywele kwamba amerogwa, si ndio? Hakuna kurogwa. Na huyo mtu anaweza akatibiwa ama situation inaweza kuwa managed. Yeah. So the moment you understand that, utakuwa unaona huyo mtu ni kama mtu anahitaji usaidizi. Mtu wenu akianza kubehave, because the first sign the people who are close to you are the ones who are going to notice that you have a problem. Unasikia Juliet, kuna kakitu?
Akuangi hivi.
Juliet akuangi hivi.
Yeah.
And maybe they'll talk to you or they'll tell people who are close to you. They tell your parents or your spouse or your boyfriend, girlfriend, so and so, kuna kitu si right. When we hear about this, it's good to take action. Maybe the first one is psychotherapy. get someone to talk to this person. Get someone to try and assess what the problem is, because it will go on progressing. So the moment people notice that you are behaving, I said there are 3 areas. We say biopsychosocial. So you look at the biological factors, psychological factors, and the social factors. Then we look at cognitive, the way you think, your thought processes. When you start thinking things that in a way that you are off, you know, you are off, your thoughts, there's thought distortion, or there is a way you are thinking that you are out of reality. A person close to you can tell that, okay, your thinking is not okay. For instance, the most common that I've seen is paranoia, getting paranoia, like you're paranoid. You are afraid that the people who are around you are out to harm you. Unakuwa unaogopa tu. Unaogopa tu. Watu wote wa karibu na wewe, ule anitakiagi mazuri, ule ananiangalia vibaya, pali unakaa, unaona neighbors wako, wako na bad intentions towards you, towards your children.
Na sasa hizo vitu ni wewe mwenyewe una imagine.
Ziko kwa kichwa yako tu, hata watu hawana shida na wewe. Watoto wako hawasomagi vizuri because watu hawapendi, you know. There is something that when people look at you wanashindwa wewe unatafutiwa nini na watu. Mbona wewe kila kitu ni wewe? Unaona? In your mind unaanza kujiambia, we say you are delusional. So kuna hiyo tunaita delusions of persecution. There are people who are out to persecute. And then kuna delusions of grandeur, whereby you are always thinking of things that are just out, like that self-praise and self-importance. Unaanza kuja hapo unasema, unaona kila kitu hapa hii ni yangu by the way. Hizi zote ni zangu. Watu nimewaandika hapa kazi na wako slow, you know. So you're having delusions of grandeur. When a person starts talking about, unajua mtu ni wenu, but vitu anakuambia haziko. Hazi add up, you are like. So when a person starts thinking, ama brain yake inaanza kumdanganya, ni brain inamdanganya tu, inamuonyesha vitu ambavyo haviko. Anaongea about kufuatwa na watu. Unasikia amezima simu all the time. Anakuambia, unajua mimi siwezi akisha simu yangu, na polisi wananitafuta. DCI ni mimi simu wanatafuta tu. So like, kwani DCI inakutafuta? Hujui mimi ni nani? What you are seeing is not me. Or they believe in they can change systems, they can manipulate, they can withdraw money from the bank without even using ATM. Mimi nikienda nisimame hapo nje, I mean money comes to my pocket. You see? Yeah, that is a sign. And then we have the most common ones, like extreme fear. You're just afraid of things and you don't know what you are afraid of. Huyu mtu anakuwa na uoga. Huyu mtu anakuwa irritable. Huyu mtu anakuwa ameanza kuwa violent. Like ukaenda tuseme you are walking, umuguze tu hivi anashtuka, anakugonga, anafanya vitu zenye ziko za kawaida. Na nimesema hiyo isolation. You don't want to be with people. Unajifungia. Unapata mali huko, utaki anything to do with people, umezima hata simu. Maybe something is happening kwa brain nawe hujui. There's that, I've said, irritability, sadness. You cannot explain that. You're just feeling sad. You can be sad without explanation.
Hujui ni nini?
Inafanya usikie uko na huzuni saa zote, ama uko na extreme happiness, furaha ingine ambayo haiwezi kaeleweka. Then kuna zile basic, like when your appetite starts changing. Appetite ina change. Either unakula sana ama you lack that appetite.
Squeeze nakula sana.
Takuangalia.
I need to be checked.
Yeah, if you're eating, okay, could be other things.
What other things?
Could be other things. Many things. You're a woman. Hormonal changes. Appetite imekuja tu. Okay, there's a way you can check that. We have a way of checking whether it's actual it's a mental illness that you have or is developing,
Okay.
ama ni normal, because we all get stressed.
Yeah.
But kuna ile tunaangalia hii sio stress ya kawaida. It's beyond the normal stress.
Okay.
Na imechukua muda mrefu sana, it is taking long to go away, a long time to go away. We have a system, we call it the DSM-5. It's easier for us to know whether the signs are for mental health or they're just normal,
Okay.
because we all get stressed and all that. Sleeping habits, they change. You find that you have insomnia, you can't sleep. Umekaa saa 7 imefika, umeingia kwa kitanda, you start scrolling your phone, you can't sleep. Inafika 3 a.m. hujalala bado. So you start wondering what's happening with me, because there's something that is not right kwa brain yako, you know. Then it can change either to the extreme or to the lower, the extreme low, extreme high.
Yeah.
Or you oversleep. You find saa 5 hujaamka.
Unadhani ni kurelax.
Umerelax,
kumbe uko holiday mood.
Uko holiday.
Wow.
But you are not able to operate within the normal hours. Unapata ulilala saa 2. Hii saa 2 ingine bado umelala. Hiyo saa 2 and you don't feel like waking up. You're just comfortable. Uko sawa tu ukilala. You know there are people who can sleep for 3 good days. I've had a client amelala 1 week. Anaamka tu anakunywa kamaji, anafix kama yai. The easiest thing to fix, anarudi kwa hiyo kitanda. Because hawezi aka. Sometimes even your bowel movements change. So there's a lot of combination that we look at. Bowel movement yako is not kawaida, it's either the extreme, the hard or soft. Your sex drive changes. You're either to the extreme, whichever extreme. Yeah, it changes.
Either you want or you don't want.
Or you don't want.
Yeah.
Yeah, so there are those changes, normal changes that you will see. You will see that kuna mabadiliko. And then cognitive wise, you start having issues with concentration. Ukiongea nayo hapa hivi 10 minutes, usha switch. Akili yako iwezi ka concentrate, especially for students. Anaenda shule hawezi concentrate. So unapata kuna concentration ukiongea nayo. Energy level, unasikia uko very weak, hutaki kufanya anything. So that is when you use that criteria, yeah, to find out where you fall in the many diseases that are mental illnesses that I talked about. Yes, there's so many of them. And then we have another issue when most people are not able to cope. They start looking for solutions because uelewi. You've not been told mental health inakaaje, mental wellness inakaaje. So what do? You start looking for your own medication. And medication ni drugs. Most people wale wako na mental health issues, they start taking drugs. They start maybe kukunywa ka alcohol, kidogo kidogo. And anytime they stop it, wanna feel that uneasiness. They start feeling like they are not okay. There's something wrong with them. So what happens is they continue now taking alcohol. They go start taking marijuana. They go taking all types of drugs because they are looking for a coping mechanism. So trying to stop that urge to feel maybe suicidal. Unajaribu kustop hiyo. Utaki kufeel ni kama uko useless, uko worthless, so unakunywa pombe.
Ni kama utaki kufeel ni kama kuna kitu inakusumbua na huelewi ni nini inakusumbua.
Uelewi ni nini, wewe unataka tu kukunywa. Atuacha, let me drink nitoe my problems, my sorrows, my what. But you actually have a mental health problem. That's why utaona atakunywa siku moja unaenda unasikia amejihang. Unaona? Amejirusha kutoka kwa gorofa. They eventually like commit suicide. Yeah, so suicide is another sign. And this sign iko kwa, for example, the idea. We say suicidal ideations, the thoughts. The thoughts, when you are looking, we are doing intake, we check whether you have the thought and whether you've ever had maybe a plan, there's a thought, there's a plan. You planned, ukasema, okay, I'll go, which one is the best way? I'll go buy medicine. Tena ninunue dawa ya panya. Now you've gone beyond the thought, you've gone to planning. Yes. And then from there, we go to the attempt stage. So we check our clients, we ask, amefika stage gani? Alikuwa na hiyo thought, alafu aka plan, alafu attempts. Unasikia mimi nimejaribu mara 3. They try. So when you tell a person who's suicidal, si uende ujinyonge, chukua kamba uende ujinyonge, they can actually go do it. It doesn't mean that mtu akijaribu once, ati amesikia uchungu hatafanya.
They'll do it again and again.
They'll do it because it is a mental issue. Yes, so that is the stage where when you are not able to understand what is happening to you, you feel worthless, useless, so you decide to end your life. And that's why there's a connection between suicide and mental health.
Mental health.
Yes.
Wow. Is there anything you have left?
The other thing that maybe I want to say is when you have mental health issues, sometimes it doesn't come out like mental health. We say you get psychosomatic symptoms, symptoms in your own body. Now they come outside. You start experiencing headaches that you don't even understand where they're coming from. You have problems, your shoulders, they're paining. Sometimes you're having your back paining, your stomach, you have many stomach problems. So, ulcers, just a lot of discomfort.
Yeah.
Then when you're having all these things, you go to hospital, they do all the tests. Ndio wengine unasikia hii ni kurogwa.
Juu hakuna kitu inaonekana.
Nimeenda hospitali hakuna kitu inaonekana. Kumbe it's psychosomatic.
Yeah.
The problem is actually in your brain, and because I said it's the engine to everything, you find that you are not able to understand what is going on. Yes. Ebu picture this. Say you are called for a very important interview. You get that phone call that you've been waiting for. What happens to you suddenly?
Utaskia excited, looking forward, kuenda.
No, your body, what is your body? There are people who get stomach, hata unaharisha, you know.
Butterflies.
Hizo tunazita hivyo. Unaharisha. Kuna hiyo mshtuko unapata. You've won a lot of money. The first thing unakimbia kwa choo. Because it's psychosomatic. It goes from your brain to your body. When you are stressed, what happens? You feel some pain, maybe kwa shoulders, or when you are having you've overworked, you've not had enough rest, so your brain is so tired. So you find that your body reacts to that. Your body reacts to that. Ukifanya kazi nyingi ukiwa umechoka sana, mwili wako utakwambia. Your brain inafanya kazi sana, uko na watu wagonjwa, uko na mashida nyingi, hujalipa madeni, hujalipa chama, you start getting those psychosomatic problems. I forgot to tell you another cause would be kama wewe umekuwa na ugonjwa kwa muda mrefu, ama uko na mtu wenu ambaye ni mgonjwa kwa muda mrefu, taking care of a person who is unwell can also cause mental health issues.
And most times hawa watu wanaangalia wagonjwa nyumbani, wanasahaulika sana.
Sasa hao chances yao iko juu sana.
Yeah, kwa sababu most of the time nikipiga simu tuseme ni mimi niko mgonjwa, someone who calls my husband or my family, they will ask Juliet anaendeleaje. You know, they will not check on this person mwenye ananiangalia. So you find that hawa watu wanasahaulika na wanapotelea somewhere in between trying to look after those people wenye wanasaidia.
Yes, you are right. So wakati unaangalia huyo mtu ambaye ni mgonjwa, we call the terminally ill, you will definitely get affected. And the moment you have that sick person, or you've gone through experiences like death. Death, sometimes we say complicated death. When it is like death this year, next time you're having death, another relative dies, you can easily get mental health issues. Or you go through divorce or separation. That can easily cause mental health problems because you were used to a certain system and that has changed. You don't know where to start from, what to do. It's also, divorce is also another cause of mental health issues. Yes, you find a person going to drugs, drinking because they're not able to cope with that kind of stress.
Okay, I remember you mentioned about coping with the day-to-day stresses. Nowadays kuna vitu nyingi sana happening around, you know, the economy, you know, things, vitu tu zina happen. How about that?
Of course, that is the biggest stressor we have. We are not able to cope with many things. We are going through issues every day, be it our children, be it the economy, just not having the money in the pocket. But the debt can also be a cause of mental health issues. Then you uko na madeni left, right and center. You can't even sleep. So you start getting stress.
Na kazi pia hazipatikani.
Kazi, or even losing your job. Yeah, so mental health is when you feel like things are not going okay, just seek help. Seek help. Talk to someone. Yes, talk to someone, people who are close to you, people you trust. If you don't trust them, or if it has gone beyond them, you seek professional help. You see a psychologist, psychotherapists, they'll talk to you. Go see a psychiatrist, a doctor. Even a doctor will help you because it's a problem. Yeah, it's a problem in your body.
Okay. You said there's a way you assess the patient. Maybe you can explain more on that.
Assessment, we start from physical. Physical, as in ukitoka pale hivyo, my assessment starts. When I look at the way you are walking, you are talking, you are laughing, everything. Yeah, so assessment starts from physical observation. Kuna vile utatembea tu mtu aone, mbona umetembea hivyo, you know. And then when I talk to you, I also pick a lot. Because like I told you, nitasikiza vile unaongea. Are you delusional? Hizo vitu unaongea ni za kweli? Are you making sense? Can you reason? Can you reason? Like if I give you a small test, ask you a very basic thing, are you able to respond? So by talking, I'll pick a lot of things. I'll be checking whether your concentration level is at what point. Tangu tuanze kuongea, whether una switch, unaenda to other things. Whether you do understand what I'm telling you, your understanding level. Then, of course, I do the assessment, maybe finding out from you whether your eating habits, sleeping habits, everything. Then we do psychoanalysis, which means I'll go back to history.
Okay.
To know where you grew up, how you grew up, to check whether there were other stressors or situations that have made you who you are. So lazima niangalie maisha yako ya kitambo. Kwa sababu you are what you were, I mean you are the life you lived when you were young. Ile maisha ulilelewa nayo ukiwa mdogo, ukikua ndio unaishi sahi. Zile tabia uko nazo ni kwa sababu ya vile ulilelewa. Ulilelewa wapi? Ulilelewa na kina nani? What happened? Ulienda shule wapi? That is the person I'm seeing today. Ndio wewe sasa. So tukishafanyia assessment, now tukidetect kuna a mental health issue, then we now go to DSM-5, whereby we look at the categories. Tunaangalia criteria. What criteria, like you have these symptoms, where do they fit? Juu kila symptoms zina fit ugonjwa tofauti. Ndio tujue uko na shida gani, tujue the kind of treatment that you will be given. Yeah.
Okay. Na kuna pia a group of people, someone knows or they have come to the realization they are going through something. But it's very difficult for them to open up. It's very difficult for them to even talk to a person. Mtu kama huyu unaweza mwambia nini ama anaweza saidikaje?
That depends on okay, You know, you have categories of people, you have personalities. People are different. People are different. We classify them differently.
Okay.
And then kuna disorders ambazo tunaita personality disorders. They could be having like some personality disorders, like schizoid personality. They don't like associating with people or sharing much. They have a disorder, but it's a personality disorder.
Yeah.
Schizotypal. We have types. So once they're in that criteria, you might not be able to penetrate or to be able to, for them to come out, because they don't talk much, they don't associate much, they like their own privacy and all that. Such a person, as family, you are the person who know them better. I've never seen a person who do not have a favorite. They always have that person.
That favorite person.
That can talk to them.
Yeah.
But if you look at the person and see that they actually have a mental issue, a serious mental issue that needs to be taken care of, the best thing is just take him by force aende atibiwe. Yes. Don't just look at him useme anakataa kwenda hospitali. Yeah. They don't like going to hospital if they have mental health issues.
Okay.
Yeah. And if the one who takes them is their enemy, by the way. They don't like that person. Because they'll be confined to maybe a place.
Yeah.
Maybe zile madawa, sindano. It's an experience that they maybe hatapenda.
Okay.
Yeah.
As we come to the end, what would you tell people? Someone out there, maybe ako in that phase, ana labda zile signs zote zenye umeongelelea, ana feel, ana experience. Your last words.
One thing I'll tell you is that maybe that person will not realize, but the people around them will know that they have a problem. So once you realize that you have an issue, or the person that is close to you, your friend, your relatives, are showing the signs that I've just discussed, it's very important to help them. The only way you can help them is to look for a professional to take care of them, to do analysis, to find out exactly what they are suffering from, and maybe get treated, be given medication, because kuna dawa, watapewa dawa, they are given medication. So don't let your people roam around, that amerogwa sijui nini, usiache mtu wako hivyo, mpeleke atibiwe, kwa sababu kuna tiba. Na kama kuna situation like schizophrenia, sometimes it's not easy to heal. Sio rahisi maybe kupona. Kama ni kitu ambayo ni serious, atapewa dawa, atakuwa anakunywa na anakaa maisha ya kawaida. So tusiachilie watu kwa sababu wako na shida ya kiakili, wakue huko nje, wanatembea kila mahali, tumewaachilia tu. Those are, ama mtu amefika mahali anataka kujiangamiza, or they want to do death by suicide. Yeah, so it's good to take care of the people who are close to us. When they have mental health issues, it's for us to see that and help them. And if you feel that you have a problem, usifikirie wewe maybe ni shujaa sana, ama wewe unaweza. Mental health issues hazina shujaa. Mental health issues, they can affect anyone, from the lowest level mpaka wale watu wa juu kabisa, kwa the hierarchy of whatever, be it academic, be it social life, be it wale wamefika hata self-actualization, they can have mental health issues. Yes, so hakuna shujaa. There's no person who can say that they are beyond mental health. We've seen doctors, mental health specialists getting issues also. Haina shujaa. It does not have a person who cannot get affected. Any person can get mental health issues. So let's be careful. Let's preach it. Tuambie watu wengine. Tuambie hizi signs zinawaambia, ukiona hivi mtu wetu ako na hii, mpeleke hospitalini. Yes, we have government hospitals ambazo zina cater for that. Na tuko na therapists wengi ambao wanaweza wakasaidia. So let's not keep quiet.
Okay. Someone who would want to get in touch with you, unaweza labda tupeana namba yako?
Yeah.
Yeah.
So you can get in touch with me 0710 76 2476. That's my number.
Okay. And of course, you have it on the
Yeah,
screen.
the screen.
So that someone can get in touch.
Yes.
And I'm so grateful. You've said something very important. Let's keep preaching about mental health awareness. This is something that is very crucial because kama akili yako haifanyi vizuri, Kista amesema it's like a system that runs the whole body. So if it's not okay, then you can expect, you know, shida ya mwili yote itatoka hapo. So thank you so much. I have been your host, Juliet. Until next time, let's keep preaching mental health awareness. People need to know so that they can take good care of themselves. We can take good care of each other. Until next time, bye-bye.